Hello, my name is Jessica Tapia, and thank you for letting me be a part of the Puerto Rico Food Symposium. I'm a licensed massage therapist in the state of Texas, and today I just wanted to share some tips for you guys to incorporate in your next self-care routine. So let's talk a little bit about some massage techniques. There's going to be 3 techniques that I want to talk about. The first one's going to be Effleurage. Effleurage is more of a gliding technique. So Effleurage is just gliding on the skin. Whenever you're doing this type of work, you're going to want to go towards the heart. You're going to want to follow the circulatory system that we have. So Effleurage, again, just gliding on the skin. This is a really great introductory technique because it lets you assess the tissue. It lets you find out if there's any areas that we're going to need to work on. If you do find any areas that you have to work on, we're going to now use our other technique, which is Petrissage. So Petrissage is a kneading technique. So you're actually lifting the tissue and moving that muscle around. Petrissage is a great technique to work out any muscle adhesions that you feel. And this is going to be the one that we use the most to actually get rid of any tensions that's in the muscle. And the last one that we're going to focus on is compression. Compression, just how it sounds, you're applying pressure to the area that you want to focus on. Compression is really good for bringing blood flow. The way that it does that is by pushing down on the area. You kind of restrict the amount of blood flow going through it, but once you release, there's a rush of blood going through there. Blood is helpful in bringing fresh oxygen to the area and also cleaning out any waste that's there. Now that we've talked about a little bit of massage techniques, let's talk about the routine that we're going to focus on. Now, we're going to focus on a routine that is for the neck. In general, the neck is an area where a lot of people have tension, and for musicians, they have a lot of tension there because they have to look down at their music stand or they have to hold their head a certain way for their embouchure. Now, focusing on the neck, you're going to want to start at the base of your skull and then work down. So focusing on the base of the skull, we're going to use our palm. We're going to use the bottom of our palm, and we're going to find the curve where your base of the skull is. We're going to put that curve right at the middle of the palm, and we're going to push up to do compression to help relieve some tension that's there. So just like so, I have the curve of my skull right here. I have it in the middle of my palm, and I'm going to go ahead and push up and relieve any tension that I have there. It does work best if you're doing both sides at the same time. So putting your hands at the base of your skull and then pushing up. You can do this about 2-3 times. This is just to warm up your area and loosen up some of the attachment sites for the muscles that we're going to be working on. You might lean back a little bit and add just a little bit more weight, and that's totally fine. The weight of your skull is going to help you as well as you're working on your neck area. So after we have worked the base of the skull and loosened it up a little bit, we're going to want to use our fingers to go down and work on the spine a little. Now, as you're going down your neck area, you're going to want to go in a circular motion to try to work that tissue that you have there. Now, if you're going straight down the sides, it's going to hurt. And if you're going straight down the back, it's also going to hurt because those are where you have your bony parts. But between the side and straight back, you have a little groove area. The groove area is where your muscles actually hang out. That's the area that we're going to focus on. You might feel yourself being able to go deeper into that area as you rotate. And then we'll go over that in just a bit. So you've released your pressure at the base of your skull. You can also start going down the spine by starting at the base of the skull and going outward until you're at the spine area, and then you can start going down that spine. You're going in circular motions, working down that spine. Now, earlier we said that you might want to lean your head back to give you some weight, and that's totally fine, because as you're working down, you're going to want to lean back as well and rotate and feel that tissue move under your fingers. That's one way to do Petrissage, which is the actually moving of the tissue without actually lifting that tissue too much. So you're pushing down on it and then you're rotating your head, and that action of the rotation is what's moving that muscle. So you can do the circles going down, or you can lean back, find that spot in the middle where the muscles are hanging out, and then rotate your neck back and forth, back and forth. And if you find that you have a spot where it really hurts when you rotate, just hold it there for a few seconds and let the compression help. Once you have worked down the spine, you're not going to want to just stop there, because then you still have the rest of your shoulder area where it all attaches to that is still real tense. So once you get comfortable enough with warming up these tissues back here, you're going to want to strip from this base of your skull and go all the way down the spine of the neck and outwards towards your shoulder. And then if you feel a little bit of tension, give yourself a little stretch, push your shoulder back as you bring your neck forward to stretch out this area right here. So again, you worked on the base of your skull, you worked on your spine, but you don't want to just stop there, because it all connects right here to your shoulder area. So if you go all the way and work all the way out to your shoulder area, then you have a nice flush of this area and a good workout of the whole area right here. So at the base of your skull, you're going to go down the muscle, all the way till you get out towards your shoulder area out here. And then again, if you feel like your shoulders are really rounded in or very tense, you can push back on your shoulder as you push your neck forward to kind of stretch it out. Alrighty. So I hope you guys enjoyed this routine. Very small, very simple, but this is where a lot of people have their tension. Again, don't forget that if you want to lean back on it, it helps. The weight of your skull does help release some of that tension. And as you're working on your trouble spots, you can go in circular motions to work on that tissue, or you can just lean back and rotate and let the weight of your skull and the rotation work on that tissue for you. If you have any other questions, you're more than welcome to reach me at Needing Clinical Massage on Facebook. My name is Jessica Tapia. And again, thank you for letting me be a part of the Puerto Rico Food Symposium. Hopefully we can see each other next summer.